Hello, everybody, and welcome back to TartleCast. We want to discuss, actually, let's make this simple. We want to talk about the benefit of storing your medical information in Tartle.
Oh my God. Like we have comments, like if you go to Reddit right now,
Yeah.
I'm so glad you brought this up.
Okay.
In Reddit, it's like, why would I put my prescription drugs? I don't trust them. They want my RX.
Okay. All right. So
I think this would be great.
Yeah, let's be clear about a couple things. And if you want to see this through, inspect the code when the web page is loading, and also look at the patent. Tartle has no way, shape, or form for accessing your data. It's completely obfuscated from us. We have no control or power over it. We created the system so that it's 100% in your power and control. Mm-hmm. I don't want your RX data. I don't give a shit about wanting it. What am I going to do with it? Nothing. We created a system that allows you to permission that information to people who do want it when you choose to do so. The thing is, you hold the keys to your Tartle wallet. I don't know what they are. That's like asking me what your passcode is to your phone. I don't have a damn clue what the passcode is to your phone.
But like the word wallet can seem, I want to be real first principles here. The word wallet can seem like there's just holds money or credit cards.
Yeah, no.
What is the wallet holding? It's like a vault.
It's more of a vault. It's a big secure vault. You know, like the big cogwheel in front.
No one can get in it. There's
thick doors.
Yeah.
And it holds everything. It can hold your money. It can hold pictures. It can hold personal records of you. You know, like whatever it might be.
DNA.
Yeah, I don't care what it is.
23andMe, whatever.
The interesting part about Tartle technology and the Tartle data vault that you have your own independent vault, all right, like a big bank. You're the only one that can walk in whenever you want, open the door. You're the only one that can see inside. You're the only one that can move and rearrange things in your vault. Tartle doesn't have the ability to do so.
We would have to buy that from you.
Yeah, if I wanted it,
If I wanted RX data at Tartle, I have to log in as a Tartle, as a buyer, and then ask you permission to get that data. And then you could choose to sell it to me or not based on what your value of that is.
Yes.
Because it's so funny because it's not really a privacy issue.
No.
Because there's a price.
There's a price.
For your privacy.
Yeah, so for some people.
If you said, hey, I'm going to put you in this big Bel Air mansion in LA, but unfortunately your backyard, there's a pool and a hot tub, but there's no fence around it. Yeah. But you can live there for free.
But everybody gets to see and watch me all the time?
Yeah.
Yeah, the price is free.
Yeah. But is that worth it to you?
Yeah, you have no privacy.
Yeah, it is, because, and I could give up some of my privacy.
Yeah.
If the value, and value is a really important word, if the value, because people take value and don't use it, and I don't want to get too esoteric here, but evolution has reduced value to something that is like narcissistically for me.
Yeah. It's purely,
not for humanity.
No, it's purely transactional for you.
Yes, yeah.
Yeah. Now, here's the element of this. This RX data, because we'll use it as the example of people in the subreddits of subthreads of Reddit, right? When they say, like, I'm not putting that in there.
I'm going to give them this link, each one.
And I'll tell you this. Don't put it in there.
Yeah.
I don't give a shit. I'm not forcing you to put it there. We're giving you the option because companies want to know that stuff.
Right.
Now, let me share you this. If you've ever picked up anything at a pharmacy at CVS, have you?
Yeah, of course.
Do you know CVS is actively selling that data and you get nothing for it?
Mm-hmm. Yeah.
So all I'm doing is creating
all of them are selling data.
Yeah, all I'm doing is opening up the opportunity for you to sell it directly to the people that weren't coming to you directly, and we're going to CVS, and CVS was like, sure, I'll take the economic gain off of it.
Yeah, but if a pharmaceutical company said, hey, we want to buy Alex's RX data, and you have two medications, let's say, and both of them would be for mental health, I would imagine.
Nailed it.
So you take these two RXs, and the company said, hey, I'll give you $110 to know the names of the RX.
Yeah.
Okay.
I'd do it all day.
Oh, I would too.
I do it all day.
I'd be like, I don't care. It's not a big deal.
No, who cares? But listen, that's our personal flavor. But the way the technology is designed is that you can put your personal flavor in it. Mm-hmm. And to be very, very clear, the system was not designed for Tartle's benefit.
No.
The system was designed for your benefit.
It's built for humanity.
RX is there like as one of those data packets for you, not for me. Do I look like a pharma company? Do I look like you? I have no interest in it.
No.
I don't want to know what's inside of it.
Well, if people want to really understand what Tartle is and take the time to do it, we've done a ton of podcasts. You can go through that. Or you can go to tartle.co/philosophy, and you'll talk about, we go into data consent and data equalization, and we hit all of the things that would end your worries to what we are. Do we make money? Of course we do. How do we make money? The buyer has to pay a percentage from that data. Does that go against you as a seller? No.
No, we don't take anything for you. You get 100%.
The buyer has to pay the exchange rate.
Yeah,
if you want to call it
like
that.
we said, look at the patent. Inspect the code yourself.
Yes, you can. It's super easy.
Whatever. Share this with those folks.
So I want to talk about a problem that's happening because I think it's important we handled the Reddit thing.
Yeah, thanks Reddit.
Yeah. If you want us to talk about some other stuff, put it in there.
I don't care. Comment all day. I'll talk about it constantly.
So here's a problem. And I talked to a friend about this yesterday.
Is it a problem or an opportunity?
Well, it's an opportunity for us.
Yeah.
Went to visit family members in Austin, Texas from Albuquerque, New Mexico. Had an emergency room issue with some issues with allergies and stuff like that, allergic reaction and stuff that went on.
Okay.
Goes into the emergency room.
Yeah.
It's like a breakout, skin breakout, all that. Goes in the emergency room in Austin. They have to redo what allergies you have, what medications are you on. Why can't they just simply take all Presbyterian, that's a hospital here in Albuquerque, or for me, the VA, I go to the VA because I'm a disabled veteran. Why can't they take that information and easily have it in their system? But me being in control, I could be like, yeah, I'm in the emergency room, go on my phone. Here's all my data and then the AI in Austin can read it real fast and be like, yeah, don't give them this medication. This is it.
Yeah, this is called healthcare data portability. Now, many people have tried to work on this. And by many people, I mean governments. And we all know how useless and fucking ineffective.
I don't want the government to have my medical data.
I know. Yeah. So here's.
Even though I'm part of the Veterans Association, the VA.
Yeah. So check this out. When it comes to healthcare data portability, they tried to set up these things called health information exchanges. States would, and most of them flop. They suck. Nobody ends up using it because it doesn't tie into the medical system of they call them EHRs, or it doesn't tie into that or the care management system of the plan or the hospital that you're at. So people are like, yeah, it's a farce because people want to do it. Like, a hospital should be able to just request it from a health information exchange and get this. But then other companies show up like pharma, like, hey, we want to get into health information exchange. They don't want free shit and not paying anything, right? Trying to skimp, right? Now,
shareholder value.
What you're discussing here is one of the massive healthcare unlocks when it comes to Tartle. You can store the healthcare record that you have inside of Tartle. And the plan could request that from you, and you could permission that directly to them. You can give them the record. You're the person that unlocks that. It's very, very difficult. Because of HIPAA, they had to create these health information exchanges and anonymize some stuff and create this really ridiculous request system when it could be super direct with your friend who is down in Austin, right? Would have just been like, here's my Tartle thing. Scan this to request it from me, and I will permission it to you. This data from my data vault. Fucking awesome.
Yeah.
Now, here's the other stupid part about the medical industry. You ready for this? Each of these hospitals that reside under some larger corporate plan, right, insurance plan, their care management systems or EHRs, electronic health record systems, they all have different code.
Oh my God.
Let me tell you how stupid this is.
Why isn't there like a
I know,
Dewey Decimal System?
They're trying to do it, but they're a flop. All right, they call this thing FHIR7, all right, FIRE, which is a way that the way healthcare information is recorded in these systems to become standardized. They haven't done it yet. The plans aren't incentivized to do it because people like Epic don't want to share that data because they know how valuable it is to them not to let people take it and monetize it themselves or share it around, because you want to own the members. Because if you own your members,
of course, yeah. This is basic marketing.
You can bill upon them more, right? It's really stupid.
You want LTV, lifetime value of the.
So the only way for us as the public to fix this and unlock it is to use a system like Tartle to say that I'm going to be the one that ports my healthcare data from hospital 1 to hospital 2, or doctor A to doctor B.
I love it.
And I'm going to be the one to permission it, and it comes right out of my data vault. And by the way, there's no reason the hospital couldn't even pay you for that, or even reduce the cost of your visit. Because they spend so much other money just in labor costs, getting people to re-record their
Or the
shit.
insurance can pay for it.
Yeah, exactly.
They can pay for a data transfer.
So the point is,
how many line items do they have now?
yeah, the point is, a lot of these things won't change until we, as the people who are sick or patients, take healthcare data portability into our own hands and demand that transfer ourselves.
So what do you think? What do you think healthcare looks like decentralized?
Healthcare looks like decentralized.
Yeah, I mean, like, especially when it comes to data.
People come onto Tartle, and when they go to a specific hospital, that hospital, the EHR system or care management system, is already linked into Tartle using their credentials. You know, you can log in
because this is like a topic that's beginning to come up. Like, decentralization is kind of a hot word with Web3 and all this stuff going on.
Right.
But like healthcare decentralization, I think any of these large, like Uber did this, a startup unicorn always happens because it's decentralizing something that was like held, by, like some, like holy, it's like Indiana Jones. Yeah. You got to go to the caves, go through all the things, be smart enough. And then finally you get it and then you got to run, So these large mega corporations that are holding all of this and then won't let it go, different codes to kind of trick people.
Yeah.
Decentralized healthcare, that would put the power back in the people.
Right.
And give self-responsibility.
And think about the efficiency of being able to pick up and move and
that's what I'm talking about. Yeah.
And set up your healthcare at new providers. It'd be a fraction of the amount of time. And it would be of an economic benefit, not only to the insurers, but to the hospitals and yourself.
Well, it's so silly because you can go to any DMV and get a driver's license.
Yeah.
Why can't I go from Austin, Texas to Albuquerque for my health?
They isolate those.
My person is my body. It's the most important thing. Or what about my children?
Well, the healthcare system is just as corrupt.
This is a problem.
It's what it boils down to. So if we want to uncorrupt it, make it efficient, and actually move out of a state of sickness into a state of health and be proactive, we need to become responsible, you and me, and other people like us, with our healthcare data and store it in systems like Tartle.
Why do companies, I'm going to ask a really good question here. I feel it's good. Why do companies want people to think that their data isn't worth anything?
If somebody tells you something's not worth something, that means it's worth a shitload.
I mean, we know this, but I want people to understand this.
Yeah, they're making a mint off of it.
Yeah.
What would be the first thing? So say you're a bad actor, right? And you're like, man, I'm making so much fucking money, like pulling this data from people. They don't even.
It's know like, what's that horrific movie with where they went on to the indigenous tribes and tried to steal the oil from it? Had Leonardo DiCaprio in it.
Oh, you're talking about Moon, Under the Flower Moon or something like that.
Yeah, under something like that. But it's like that. It's like, oh shit, there's millions of dollars here. Let's see if we could, give them $1,000.
I'll give them $1,000.
Let's marry these girls.
They pushed out all these studies saying, oh yeah, your data's only worth like $10.
This is the whole thing. Yeah.
Fucking crap. Let me give you.
It's the same that's like sugar doesn't kill you or cigarettes are totally fine.
Yeah.
Here's a medical doctor smoking. It's the same bullshit.
Let me tell you something here. Your genome sequence, if you have some sort of terminal illness, right, or a disease, it's worth $1,000 for someone to study. That's a genome sequence, okay? Your habits as you're trending across the internet, cool $100 a year, just to see your browser history. If you go in to a doctor's office and record your appointment and store that on Tartle, you can sell that for $500. Think about these things. If they're telling you your data is not worth something, that's crap. All of their businesses, all of their workflows, all of their algorithms are completely dependent on your information.
Well, here's what's even more funny is we're in this AI boom, and what people don't understand, the two biggest problems, number one is energy to fuel these fuckers, these huge data centers. Number two is data. They don't have enough data. They talk about it. You can go on any podcast right now. What's the two biggest problems? You can ask ChatGPT right now. What are the two biggest problems with AI? It's going to say, don't have enough data. We don't have enough energy.
Yeah, that's it. Energy costs are too much. We can't support it. And there's not enough fuel in the system. Okay, guys. Guess what? We had an oil boom once. Now we're having a data boom. So instead of letting a couple core key players continue to tell you that your information is not worth anything, fuck them. Go to Tartle. Start dumping all your data into it. You take ownership of it and get some money from it.
I want people to understand historical aspect of this, how data can become an asset. I look at Bitcoin.
Okay.
Bitcoin's the 9th largest asset in the world now.
People laughed at it, didn't they? Remember when it first came out?
Well, it's what. So
Like, ha.
you became the 9th largest asset. I believe it'll probably be like 3rd or 4th or 5th or something.
Yeah.
But you became the 9th largest asset in 15 years.
Mm-hmm.
How quickly could data become the 9th or 8th or 7th or 1st largest?
3 years from now.
That's what I'm saying. It's like it's so simple to see.
Yeah, and so I'm just cluing you in ahead of time, especially for the folks on Reddit and the ones in the beer money thread. Congratulations for being on Tartle. One, thank you, and giving your feedback and being ahead of the game. You're there before the thing pops. You're like those early adopters, and I commend you for it. And what we have seen here, because we analyze internal marketplace metrics for the value of data as an asset, it is trending higher and higher every single week.
Well, the more people that sign up,
Yeah.
we've talked about this. It's network effect.
Yeah. It's trending higher every single week. When's the last time you saw an asset that did that? That's my fucking point. So whether it comes to, democratizing the data itself or cleaning up the healthcare system to have better portability of your information and permissioning over it, or sharing your RX data, not to us, but to those who request it
Or don't.
Just remember, you're in the early days of something incredible.
Yes,
And if you're paying attention, people will request more and more of it. So you might as well be there and permission it away rather than have them steal it from you.
Mm-hmm.
Gain something from it.
It also sets a precedent. Like
that's a good word.
And when we're looking at like policy and different things like that, and we just had a big meeting a week ago on a Friday. We want to affect policy when it comes to data.
Yes.
And we want to do that for you. Like for you, as because one of our big core tenets is that you can't go against somebody's free will.
No.
Like it's a philosophy of Tartle. And data privacy, when you don't have privacy, it's somebody through force going against your free will.
Yeah.
It's a basic principle.
It's a core tenet of our technological design too. We're doing everything to make sure you are more empowered with a technology that's actually beneficial for humans than most other things which you interact with on a daily basis. That's all we want to do.
And it's more than just New Mexico, because a lot of the Reddit's New Mexico. It's more than New Mexico or the United States. It's global. We want data equalization. We want people in India to know that it matters. Like,
yeah, and
we just had a conversation with some people when it comes to medical data in India and being able to. We're doing a pilot. It's like so awesome the things that are happening globally.
And the values normalized. This is important.
Right.
Just because someone's Indian in India, we are seeing their value is not worth less than someone in the United States.
Yeah, it's 100%. Yeah.
What happens is because of the marketplace tech here at Tartle, you can see the global value for that asset.
Mm-hmm.
Do you think the people of India are going to want to trade it for under the global value? Not a chance.
Right.
Again, it's designed to put the power back in the hands of normal people like you and me.
Yes.
You and I are going to affect policy. This company will change those things. We will set the standards. Tartle, bar none, is the finest company in the world for determining if there's an ethical data practice actually in play. Not because a government has determined so, or some sort of, independent body that's measuring these things under an ISO practice.
Yes.
We will tell you at the core, because of technological design and the people we partner with, if those people actually have ethical data practices. If you don't see them working with Tartle, do not work with them.
Well, it's like when you get the government involved in trying to make that, and I've talked about this before, but there's those old cartoons where, the wolf dresses up. He puts like a zip outfit on of like a shepherd.
Yeah.
And he's like, oh yeah, I'm going to come in here and I'm
nobody
going to
sees
pretend like
me.
I'm a shepherd.
Yeah.
That's the government.
Yeah.
Any government.
That's any government. But our point is, if you don't see the Tartle badge on something or powered by Tartle, don't touch it. Don't interact with companies that don't fairly give you that data back, the value of that data back, or even give you your data back. Mm-hmm. Do you know how many apps are out there that don't even allow you to pull your data down?
Well, this is something I was thinking of the other day is, like not only, and this is more personal, but something that I want us to build here at Tartle. Not only do we have like referral systems and stuff, and we encourage you guys to share this to your friends and family because you can make more money by having more people in the system, but I want buttons to be able to click where it automatically will put the email address of like support@facebook.com.
Yeah.
And then you could send an email, personal email to them So if we have millions of people sending millions of emails to these corporations that says, hey, why aren't you on Tartle? Why aren't you buying data? I want to give you permission. I have data for you to buy. Here you go. And it's just one click button, pops up your Gmail.
It's like a one-click petition to
It pops up yeah, exactly. But it's just millions are happening all day. I have good ideas every day.
Yeah, you do have good ideas.
I don't know how it works.
Yeah. And so honestly, we're here, we answered this stuff. We're always listening. We are always watching. But the one thing we're not doing is controlling your data. That's your job for you to do. And we hope that you
the governments and corporations.
We hope that you have all the personal gain from it. So thank you for joining us again here on TCAST today, and we will talk to you soon.